Welcome back. 1 in 4 women between the ages of 20 and 44 reportedly have some type of cardiovascular disease. That's according to the American Heart Association. Data also shows heart failure is among the leading cause of pregnancy-related deaths.
But health experts, they say early detection and treatment can really be life-saving. Joining us now is Dr. Melissa Walshy, practicing OBGYN and Chief Medical Director at SimplyFed, a maternal health company. Doctor, thank you for joining us. What are the most common signs and symptoms of heart failure in these pregnant women?
All right, sounds like we're having an
some
audio
audio
issue.
issues.
We were able to talk with her before the break, but unfortunately we're not able to hear her, so we'll probably bring her back.
Yeah, hopefully we can sort those out.
Okay, maybe we're getting it back
Let's
now.
go ahead and head back to the doctor and see if she can hear us now. Doctor, I'm not sure if you heard the question, but it was, what are some of the symptoms of heart failure in these pregnant women and the signs?
Yes, thank you for having me here, and sorry about the audio delay. So this is a very important question and part of why the American Heart Association has brought this scientific statement as a call to action for awareness, because many of the common symptoms of pregnancy, shortness of breath, swelling in the feet and legs, general fatigue are common but can overlap with presentation of heart failure, which are exaggerated experiences of these very common symptoms.
Do we distinguish between normal pregnancy-related symptoms from heart failure symptoms?
Yes, this is an important distinction because occasional self-limited shortness of breath can occur naturally during pregnancy and early postpartum. But when this shortness of breath is disrupting your ability to do normal activities, such as walking, speaking, doing normal things around the house, when it becomes disruptive and a pattern, that is something to alert your care team about, in addition to other concerning symptoms like chest pain, inability to lay down flat, difficulty walking because of the degree of swelling. Any of those concerns are things to bring to your care team.
What urgent red flags should prompt someone who is pregnant to get this immediate evaluation?
Immediate evaluation needs to happen for anybody having acute or sudden onset chest pain, trouble breathing at rest, any shallow, rapid breathing, change in consciousness, any fainting episodes that are recurrent, or coughing, gasping for air, all indications to go seek emergency care.
Is it easy to identify, or how can we identify pregnant women who might be at higher risk for heart failure?
Yes, identifying patients who are at risk is one of the first line tools that we have. Early identification of risk factors and symptoms can lead patients to have earlier evaluation and treatment as indicated. So patients who are at risk generally have a history of preeclampsia, high blood pressure, diabetes, or in a higher weight category. Those patients should have evaluation sooner, especially if they're having any of those concerning symptoms.
Doctor, I have spoken personally with women in our community who have had these cardiovascular issues, one pregnant, including a woman who developed preeclampsia and ended up losing her baby as a result of it. One of the things she had done was advocate for herself. She had been going to her primary care doctor only to be turned away, and it later was found out that she had this preeclampsia. So what are these questions that these women should be asking their doctors to make sure that they are being understood and that their symptoms are being taken seriously?
Yes, it's an excellent question. And one of the things that points out that we need more advocacy awareness in the community at large about these issues, because preeclampsia and cardiovascular disease can sneak up during pregnancy and the early postpartum period, especially. So marking down a pattern of symptoms, severity of symptoms, meaning how frequently and how impactful it is on your day-to-day activities, and advocating for the right tests to be done. There's a lot of great information on the American Heart Association and Preeclampsia Foundation websites with advocacy tools for patients to ask about if their past medical history or past family history influences their healthcare team's concern for their risk of developing preeclampsia and other cardiovascular disorders.
Dr. Melissa Walsh, thank you so much for your time. We appreciate you being here and giving us some insight and talking about this important topic. Thank you.
Thank you.